Welcome to the Value of Non-Physician Observations Outpatient Case. This is a joint production between the Internal Medicine Residencies of the University of Cincinnati and the University of Colorado Colleges of Medicine. The learning objective of this presentation is to demonstrate the value of non-physician observation in resident assessment. We're all familiar with the parable of the blind man feeling the elephant. Each man feels only one part of the elephant. Later they compare notes as to what they felt and find they are in total disagreement. What if in the case of resident assessment, the resident is the elephant? The attending has one view, the nurse another, peers a third, and patients a fourth. In this video, we will be showing you a resident performing in several contexts and asking you what competencies and milestones can be assessed, what score should be given to her performance, and what constructive feedback could be offered. The first part of this video occurs during a routine precepting session in the clinic.
So I have a patient to talk to you about, if we can staff real fast.
Sure.
So it's Mr. Jones. He's a 56-year-old with type 2 diabetes. His A1C when he came in today was 9.6. For his diabetes, he's on metformin 1,000 milligrams BID. He's on long-acting insulin, 25 units QHS. Okay. Short-acting insulin, he's with 8 units every meal. Okay. He hasn't had any symptoms of hypoglycemia. He hasn't had a recent microalbuminuria check, and he's not on a statin. So my plan with him today, first for his uncontrolled diabetes, I'd like to increase his long-acting insulin from 25 to 30 units QHS. I'd like to adjust his short-acting to a sliding scale. And then second, I'd like to start him on lisinopril, 10 milligrams. I'd like to check a microalbumin. And then if that shows evidence of microalbuminuria, we can increase the dose for renal protection. Okay. And then third, I think that he would benefit from a statin. He's not on one currently, but I'd like to wait until our next visit and do it then so he's not totally overwhelmed with too many changes today.
Okay. So you mentioned a sliding scale, and when you say sliding scale, did you mean basal bolus and correction or a simple sliding
Yes,
scale?
exactly.
Okay. Do you think he can handle that?
I think that he can. I think he might need some diabetes education.
Okay. Sounds like a plan to me.
Okay, wonderful.
Yeah, great.
Now that you've seen the first part of the video from the perspective of the attending, ask yourself these questions. What competencies and milestones can the attending assess? What score should the attending give based on the performance that he saw? What constructive feedback could the attending offer to this resident based on her performance? Stop the video at this point and take a few moments to reflect on these questions. Then restart the video for the second part of this presentation.
Hey, Dr. Smith, your next patient's here.
Oh my gosh, finally. He's always late.
Yeah, I think he takes the bus to get here.
Still, I mean, take an earlier bus. I can get here by 6 a.m. Anyways, why is he here?
He says it's for his diabetes.
Oh, okay. Do we know how bad his diabetes is? What's his A1C?
I don't know.
Do you know what meds he's on?
I don't know that either.
Okay, do you know if he even takes his medications?
I don't know.
Okay, I'll just ask him myself. It's okay. Thank you. Mr. Jones, I'm a little concerned. Your diabetes today was really out of control. What's been going on for the past 3 months? Have you even been checking your blood sugars at home?
No, I was. I ran out of test strips.
Well, you need to get more as soon as you can. Your blood sugars were terrible. You're really at a lot of risk for micro and macrovascular complications, and that could hurt you in the long run.
Macrovascular.
And also, your blood pressure today was very, very high. That can kill you very fast. So we're starting you on an ACE inhibitor immediately.
Look, I actually have a lot of issues with some of the pills I'm taking already. I don't know that I can do another
pill. This is only one pill. It's only once a day. And to be honest, it's a lot better than the insulin shots you have to take already. So we really need to do that because you can get diabetic nephropathy, which we're hoping you don't already have.
About the insulin, I'm not doing so well with the shots. I don't know that I can do the shots.
Oh, well, see, the insulin, I needed to talk about that too, sorry. You need to take more of the insulin, actually. You haven't been getting your A1C to goal, and so I'm increasing your insulin to 30 units QHS, and I'm going to change your short-acting as well to a sliding scale. So we're going to have to see you back in 3 months after you get another A1C check, and we'll see how you did.
I gotta do all this for 3 months? 3 months?
Yep, 3 months.
Hey, Dr. Smith, sorry to bug you. Your patient, Mr. Jones, he's calling. I tried text paging you, but he has a lot of questions about his insulin and some medications that you started him on.
Goodness, I just don't understand why he can't get this. We went over this at his appointment. Can you just read my note to him on the phone?
Yeah, I know. I tried doing that, but there's no mention of the insulin dosing, and I didn't see any mention of a new medication for him.
You know what? I'm just way too busy for this. I can't deal with this right now. If he can't get it himself at home, just schedule him with a diabetes educator. I don't have time. Sorry, I have patients to see.
What? Okay, yeah.
Good morning, Stevie. How are you?
Yeah.
Now that you've seen the performance of this resident from the perspective of the medical assistant, nurse, and patient, ask yourself these questions. What competencies and milestones can these observers assess? What score should these observers give to her performance? What constructive feedback could these observers offer? Stop the video and take a few moments to reflect on these questions, then restart the video for the final part of this presentation. Residents practice within many contexts and make many connections with other healthcare providers. In the case of assessment, attendings can have one view, nurses another, and patients a third. All have valuable information to contribute to helping this resident achieve the best possible performance. The learning objective of this presentation was to demonstrate the value of non-physician observation in resident assessment. We hope that you will take a broader view of how and why residents should be assessed and by whom in order to provide them the proper feedback for mastery of medicine. If you'd like to see more videos in this series and other series including bedside presentations and other medical education topics, go to YouTube and type in the keyword UCINTMED.